Hi guys, in this video we're gonna just recap talking about the visual pathway and we're gonna add some more visual defects. Now remember that in the last video of the eye anatomy we talked about the visual field and how do we see, and remember that we said that each eye has a nasal visual field and temporal, and that is in reference to the nose, which is here. You have your nose here, so the right eye has nasal visual field, and this is the temporal bone laterally, so the right eye has temporal visual field, and the left eye has the same thing. It has a nasal visual field and temporal visual field. So each eye has nasal and temporal visual fields, and each eye has nasal and temporal retinal fields. The nasal and temporal visual fields of the eyes are opposite to the nasal and temporal retinal fields of that eye. When we refer to a pathology in the eye, we talk about the visual fields, not retinal fields. The only thing I want you to remember in the retinal is that the one that crosses S is the nasal retinal field, which is the temporal visual field. Now again, the only thing I want you to remember with regards to the retinal field is that the S, it crosses. The nasal retinal field crosses. Nasal retinal field is your temporal visual field. Temporal visual field is your nasal retinal field. Temporal visual field is your nasal retinal field, and this is the part that crosses. Again, nasal visual field is your temporal retinal field, and temporal visual field is your nasal retinal field, and this is what crosses. So remember, nasal retinal field crosses. Each eye has nasal visual field and temporal visual field. The nasal is in the nose here, nose area. The temporal is at the temporal bones area. The eye field is opposite to retinal field. In any lesion, we explain the visual fields, not the retinal fields. So in this video, you guys, we are going to talk about what are more visual fields that the patient can have, and what is basically the pathology or the lesion that that patient have. Once you have your eye, your right eye sees with the right optic nerve, the left eye sees with the left optic nerve. The nasal retinal fields crosses, which means the temporal visual field crosses. So that part crosses to the other side, and once we cross, we form something called tract. And after we have the tract, we relay in the lateral geniculate bodies. And once we have it there, we will start to form something called the optic radiation. And that optic radiation will reach the occipital loops so that you can see. When you have the optic radiation, you guys, you will have temporal part, which forms what we call the Meyer's loop. So a part that is running in the temporal loop itself, it's lower, because you guys know that the temporal loops are lower than the parietal. So in the optic radiation, once you come into the radiation, you have two loops. One that is lower, one as the temporal level, temporal loop. So this is the inferior optic radiation, and one that is upper, it runs in the parietal loop, all right, and that is upper. Why we need to know these two things? Because we will have pathologies, and we need to know if I have a lesion in the temporal one or in the inferior loop of the optic radiation, what will happen, and if I have a lesion in the parietal loop or in the superior optic radiation, what will happen. So we might have a lesion in the optic nerve, we might have a lesion in the optic chiasma, we might have a lesion at the optic tract, we might have a lesion in the optic radiation, whether it's the inferior radiation in the temporal loop or superior radiation in parietal loop, or it might be at the cerebral cortex itself, and that cerebral cortex, the lesion could be a stroke in the whole cortex itself, so I will lose the opposite eye totally. Or it might be the problem in the posterior cerebral artery, in that we will have macular preservation. Okay, we're going to talk about that. The central vision will be preserved. So let's talk about the pathologies. So you guys, I thought of adding a picture in this. Usually, guys, when we explain something related to the patient, we would say as if we are looking in front of the patient. But in eye pathology, we will put ourselves in the place of the patient. So God forbids, you are the patient now, and you are looking at a picture, and you have both normal eyes. The right eye is working, the left eye is working, so you can see the whole view right in front of you. So what happens if you have a lesion? Let's go one by one. In order to make your life easy, guys, I added some lines, because this is your right eye and this is your left eye. Here is your nose. So let's consider that here is your nose and this is your temporal bones. Okay, so I made for each eye two visual fields. Guys, now I'm gonna talk about visual fields. Forget about the retina. Now we need to know what the patient is experiencing, because this is the exam question. It's gonna be what the patient is seeing. And once you understand what he's seeing in the visual field, you can reverse that when you talk about the retinal fields. But what concerns me now is you need to understand what happens with the patient in his visual field. So this is the patient, I am the patient, and I'm looking at this. I have a right eye. The right eye has a nasal visual field, and it has a temporal visual field. My left eye has a nasal visual field, and it has temporal visual field. So what will happen if I lose my optic nerve? So if I have, okay, so I'm now starting with the central vision. If I have a problem with the fovea centralis, the central vision problem, if I have a problem in the central vision, I'm gonna lose the central vision of that eye. So if I have what we call the central scotoma, right central scotoma, I will lose the central vision of the right eye. The left eye is going to be normal, the right eye periphery is going to be fine, but the central vision is going to be lost. This is the first thing we have. Now, what about the glaucoma? The glaucoma is opposite to the scotoma. And there you have central vision loss. Here, the peripheral vision is lost. And the more glaucoma you have in that patient, the more you will lose from the peripheral vision, and the central vision is going to be fine. So in that, here I decided to start, or maybe the diagram itself made me to start with the exceptions. Okay, if you have an exceptional problem, so the first one is the central vision, and it's quite easy that you have a problem with your central vision. And the glaucoma is the opposite. If you have a problem with the eye, then you have a problem with that eye. You're gonna lose the peripheral vision, and it's gonna be more dark, and even more if you have advanced problem. What happens in the optic nerve? So okay, fine. My right optic nerve is responsible for vision of my right eye. If I have a right optic nerve problem, then I'm gonna lose everything in the right eye, nasal and temporal fields of my right eye. So this is what we call the right monocular loss. Monocular means only one eye. Mono, it's only one eye. Okay, and it's at the same level of the lesion, because this is the nerve that brings everything from the right eye. So if I lose it, everything from the right eye is gonna be lost. Okay, now what happens next to that? Remember, you guys, I told you that the nasal S retinal fields, they cross, and the nasal retinal field is the temporal visual field. So I have visual temporal right, I have visual temporal left, visual temporal right, visual temporal field left, which means right nasal retinal, left nasal retinal. So now I'm not going to talk about the retinal field. This is just a theoretical exam question. What exactly happens if you have a compression on the optic chiasma by pituitary gland. Fine. The nasal retinal field is gonna be lost because S nasal, this is what crosses. But forget about the retina now. What happens to the patient? The patient is going to have loss in the temporal fields of both eyes. So what do we call this condition? Bitemporal homonymous hemianopia. Hemianopia, I'm gonna lose half of each eye. Temporal, because the temporal visual fields of both eyes will be lost. So the right visual, the left visual field of my left eye, the right visual field of my right eye are gonna be lost, because this is the part that crosses. So if I lose the crossing fibers, it means I'm losing the temporal visual fields. Here we are talking about visual fields only. And if you want to remember the retinal, you just need to flip it in your brain. But now you need to understand what happens to the patient. So if you have an optic chiasma lesion, it means you have bilateral temporal hemianopia. And this is what the patient can see. He can see the nasal visual fields of both eyes only. All right, what happens next to it? Okay, guys, now, once you guys read the optic radiation, once you read the optic radiation or the optic tract or the cortex, it means you're gonna lose the opposite side of both eyes. Now, if I have a patient with right optic tract problem or the whole right optic radiation problem or the right cerebral occipital cortex problem, if I have a problem, I'm exceeding now the chiasma, I'm gonna lose the left of everything. All right, guys, I'm gonna lose the left of everything. What is the left of everything? Well, if you are in the left eye, your left thing is your temporal visual field. And if you are on the right eye, the left thing is gonna be your nasal visual field. So you guys, anything that happens passing after the chiasma, everything on the opposite side is gonna be lost. Everything on the opposite side is gonna be lost. If you have a problem with right tract, the whole right optic radiation, the whole right cerebral cortex, or let's be specific, occipital cortex, occipital loop, you will lose the left visual field of both eyes. What does that mean? If I'm on the left eye, I'm gonna lose the left temporal field. If I'm on the right eye, I'm gonna lose the left nasal field. The right nasal field. Because here we are referring to right and left based on the eye. This is my right eye. I am the patient. I have a problem in the right tract or right radiation or right cortex. I'm gonna lose left of right eye, left of left eye. What is the left of your left eye? Is the temporal field. Okay, fine. Then I will lose the left temporal field of the left eye. What about your right eye? What is your left? It's the nasal visual field. Okay, fine. Then I'm gonna lose the nasal visual field of the right eye. Okay, guys? So if you have a problem with the tract, the whole radiation, cortex, right side, you will lose everything on the left side. And this is what you will see as a patient. Okay, so again, recap. If you have a problem with the nerve itself, everything is lost with that eye. If you have a problem with the chiasma, the temporal visual field of both eyes will be lost. If you have a problem with the tract or whole radiation or whole cortex, the left of everything is gonna be lost. What is the left for the left eye? It's the temporal visual field. What is the left for the right eye? It's the nasal visual field. Okay, guys? Now, what's gonna happen if you have a right cortex lesion and that lesion is caused by posterior cerebral artery? Okay, fine. We said that if we have a problem with the right cortex, then the left of everything is gonna be lost. This is okay. However, the macula, you guys, the macula is gonna be normal. Your macula is gonna be fine. the fovea centralis, the area of central vision is gonna be fine. So yes, you're gonna lose everything on the left side of both eyes, but there will be macular sparing. Okay, the central vision is gonna be fine. Okay, so you need to look for this thing in your MCQ question. Okay, they will tell you that you lost the left of everything except the central vision. Okay, so just remember that if the right cortex lesion happens because of posterior cerebral artery, the central vision is going to be preserved. But if it was like by stroke or something, then it's going to follow the previous rule. Everything is going to be lost in the left side. All right, guys? Okay, guys, now we are coming to the optic radiation. Remember that when we said once we get the information and we are done with the lateral geniculate body, the optic radiation will give you two loops. One that is inferior down, and this is in the temporal loop, we call it Meyer's loop, and one that is superior in the parietal loop. Okay, if you lose part of the optic radiation in a special loop, temporal or parietal, the story is going to be different. We said that if the problem is in the tract itself, or the whole radiation, or the cortex, left of everything is going to be lost. That is fine. But if you have a problem in only one loop of these optic radiation, that there will be a quadrangular kind of problem. What quadrangular kind of problem? You're going to have a problem in only 1/4 of the whole thing. How can we remember it? Okay, it's easy. If you have a problem if you have a problem in the inferior optic radiation, you will have a problem in the superior quadrant of your visual field. Okay, so then if I have a problem, now we are talking about the loops. I have inferior optic radiation in the temporal loop. I have superior optic radiation in the parietal loop. If I have a problem in the inferior one, I will have a problem in my superior thing of my visual field. What kind of thing? It's only square. It's only quadrangular problem. It's only 1/4 of my visual field. Okay, guys. So if I have a problem down, it's gonna be up. If I have a problem right, it's gonna be left of both eyes. If it's in the radiation, then square problem, only 1/4 of the visual field. How can we say it? We will say that if you have a right inferior fibers of optic radiation in temporal loop, if it's in the temporal radiation inferior, you will have a superior problem in the visual field of both eyes. Superior quarter. What do we call it? How can we express it? We will say contralateral problem. Left superior quadrantanopia. Quadrantanopia, guys. Superior quadrantanopia. Right inferior optic radiation. Left superior quadrantanopia. It's the opposite in direction, the opposite in upside down orientation. It's opposite in up and down orientation. It's opposite in right and left orientation. Okay, guys? So when we talk about the optic radiation, okay, remember that you have an opposite upside down orientation, opposite right to left orientation. If it's lower temporal optic radiation problem, right side, it's gonna be left side and superior. Okay? But if the problem is in the superior optic radiation, parietal loop radiation, superior, okay, fine, it's gonna be contralateral but inferior. The quadrant that I will lose is in the left side and inferior of both eyes, guys. Guys, once we exceed the chiasma, everything is gonna happen in both eyes. Okay? In the opposite field of both eyes. Remember, when it was right tract, I lost left visual field of both eyes. When I had optic radiation, left visual field of both eyes. cortex, left visual field of both eyes. But now when we are specific about inferior optic radiation, again, it's the inferior right, then I will lose superior left. If I have superior right, then I will lose inferior left. Okay, so here I have quarter problem, upside down opposite orientation, right to left opposite orientation. If I have right superior fibers of optic radiation, then I will lose left quadrangular problem on the left of both eyes. Okay, superior optic radiation problem, then I have left problem inferior. Okay, so this is the quarter thing that I will lose. So as a recap, if you have a problem with the optic nerve, you will lose everything in that eye. Chiasma, bilateral temporal hemianopia of both eyes. Tract, radiation, cortex, right side, you will lose left visual field of both eyes. What is the left visual field of the left eye? It's the temporal visual field. What is the left visual field of the right eye? It's the nasal visual field. Perfect. What about the optic radiation? If it's the whole thing, then we will follow the rule. If it's only one loop, we have to look at the loop and we reverse everything. If it's in the inferior loop, then I will have superior left. If it's inferior right, optic radiation, inferior right means temporal loop. Then I will lose superior left. Superior left, quarter of both eyes. If the problem is superior right, then I will lose left inferior visual field of both eyes, quarter only. So optic radiation, if we separate it into loops, it's gonna be only quarter problem. It's gonna be reversed in upside down orientation, right to left orientation. How do we call it? Right superior fibers of optic radiation parietal, right superior, then left inferior, quadrantanopia. If it's right inferior, then it's left superior, quadrantanopia. All right? That's all. Yeah. So with that, guys, we reached the end of the more visual defects. I hope you guys grasped the concept. If you didn't, just listen to the video one more time, and I'm sure you will be all set for any exam question. Thank you guys for watching, and see you in the next video.